The Fellowship of the Great Physician welcomes you to House Call. Our hosts today Dr. Richard Jensen.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
And as it said on the screen there, preventing cancer, and as nutritionally oriented doctors of chiropractic, certainly we have an idea of some things that can prevent cancer. And we kind of suspect from what we see going on in society that most people are not aware of that. And of course, what we're going to talk about would be good if you were treating cancer. And so some of the causes of cancer, Dr. Jensen is going to look at that and explain that. Dr. Jensen?
Thank you, Dr. Lalo. Well, causes of cancer. One is genetics. Genetic predispositions, which can be influenced in positive ways through reduction of dietary and environmental factors known to adversely affect the DNA. Next would be diet. Diet can be helped by reducing foods that are high in contaminated fats, animals that are fed hormones, antibiotics who are fed foods containing herbicides or pesticides. So they can affect us through diet by adding those chemical factors that predispose us more towards cancer and affect our internal environment. Talking about environment, xenoestrogens cause excessive cell proliferation of estrogen receptor cells, increasing incidences of breast, uterus, and ovarian cancers. Exposure to xenoestrogens such as nonylphenol, which is used in antioxidants, in the manufacture of plastics, detergents, toiletries, lubricants, and spermicides can be affecting us. Those are also man-made hormones. And bisphenol is leached from polycarbonate plastics, which are then heated and used in manufacturing. So these are things that we have introduced into the environment that are causes of cancer. We are our own worst enemies in that regard. How about the fate of estrogens, Dr. Lala?
The fate of estrogens, premenopausal women produce several hundred micrograms of E2 estradiol a day, and a certain portion find their way to estrogen receptor binding sites. At those sites, they stimulate increased rate of DNA synthesis, resulting in genes transcription and cell division. So it predisposes that those normal estrogen cells in the breasts, for example, the uterus or the ovaries in a woman, to develop cancer. And then how about the fate of estrogen estradiol, Dr. Jensen?
Thank you, Dr. Lala. Well, estrogen and estradiol are excreted. Their water-soluble fiber from the intestines plays a major role in preventing the absorption or intake of dietary hormones. Certain amounts of estrogen and estradiols are excreted and maintain a constant stimulation of estrogen-sensitive tissues. So much of estradiol is converted into estrone 1, or estrone, which is E1 usually, or referred to it as that. The half-life of E2 is about 3 hours, and all excessive hormones, conjugated and unconjugated, are excreted into the urine and bile. What this does is it looks at the liver and how the liver has to, when you put a hormone in the body, the hormone is not supposed to stay there all the time. We're always producing them, and so what we need to do is reduce those in a way, and that takes place in the liver, which takes these hormones and then excretes them out of the body so that they're not there all of the time. And that's what we're talking about in this regard, is that the liver takes them, makes them water soluble, passes them to the kidney, and then out of the body. So then the fate of xenobiotic hormones, Dr. Lala.
So as you see now in front of you, the body cannot destroy carcinogenic xenobiotic hormones or pesticides. Therefore, they continue to cause tumorigenesis or tumor development. And they live forever and therefore are continually recycled into plants, animals, and humans. That's, again, thermogenesis causing tumors. Estrogens have proliferative effect on estrogen-sensitive tissues. Dr. Jensen, how about 16-hydroxyestrone?
Thank you, Dr. Lala. 16-hydroxyestrone. It plays a major role in the growth of cancer. It is one of those biomarkers of estrogen-related cancer. So we're looking at 2-hydroxyestrone and 2-hydroxyestradiol have proven to be antagonistic to the cancer-causing 16-hydroxyestrogen, so that they should be looked at as well. How about the 24-hour hormone analysis, Dr. Lala?
The 24-hour hormone analysis is going to let us look at all of the hormones within that woman or that man's body, and when we see excesses or deficiencies, it allows us then to do natural things before they become so bad that they cause cancer. And as you see at the top of your slide, all of the hormones, male and female hormones, are manufactured from cholesterol or fats. And if you need more information on that, you can always call us, and we're happy to send you literature on it. Now, one of the tests that we're talking about here that is a preventative test is CYP1A1. What is CYP1A1? CYP1A1 is an enzyme that catalyzes 2-hydroxyestrogen, which is 2-OHEI formation. CYP1A1 is inducible through dietary modification and food supplementation. All right, how can we do that, Dr. Jensen?
Well, first of all, we want to look at some of those things that help us do that are found in the cruciferous vegetables. Cruciferous vegetables, so we've heard a lot about these lately, and they contain, part of that family of cruciferous vegetables are kale and rutabagas. How about Brussels sprouts, cauliflower, kohlrabi, and collard greens, and of course broccoli would be one of those as well. How about I3C, Dr. Lala?
13C, IC3. What is it? It's an anti-cancer chemical that's natural. You find it in the cruciferous vegetables, and you can buy it as a food supplement. IC3 means indole C3 carbinol. It is a phytochemical important in the prevention of cancer. It has properties capable of reducing carcinogenic-induced breast, stomach, and liver cancer. It reduces estradiol, that's really a bad one, metabolism by increasing 2-hydroxylation. All right, so the next one is now the effects of 13, or IC3, I3C. It reduces the effects of the xenobiotic metabolism, that's those bad hormones. It prevents papillovirus-induced tumors of the larynx and genital tract. It also has the abilities to reduce carcinogenic effects of smoking. Now, where is indole 3C carbinol found? Indole C3 carbinol, or I3C, is a natural non-toxic compound commonly combined with rosemary leaf extract. It is designed to promote hormone estrogen metabolism by assisting the body in converting estrogen into the protective, did you hear that word, 2-hydroxyestrone metabolites to the more potent beneficial 16A hydroxyestrone metabolites, which therefore can influence health of the breast tissue. Now, Dr. Jensen, what about tamoxifen? If a woman is on tamoxifen, can she take IC3?
Yes, they are synergistic in arresting cell cycling in breast cancer. So they work together. They're greater than taking one independent of the other, and making it so that the cells in the breast are much less apt to have tumorigenesis.
And we'd want them to talk to their medical doctor about that before they do that.
Certainly,
right? Okay.
Certainly.
How about essential fatty acids?
Well, essential fatty acids, the anti-cancer effects of omega-3, polyunsaturated fatty acids. This fatty acid is chemoprotective. Its chemoprotective effects include favoring series 3 eicosanoid synthesis and modulation of estrogen metabolism and estrogen receptor binding.
And is it true that DHA is also helpful in the prevention or the treatment of cancer?
Well, let's see. It causes decreased binding of estradiol at estrogen receptor binding sites in the breast, and so therefore, yes, it would be helpful.
Good.
How about flaxseed?
Flaxseed oil inhibits or has been found to reduce early markers for the risk of breast and colon cancer. The human digestive tract cannot break down flaxseed, but is released through ligands within the flaxseed and its oils, and are known to stimulate sex hormone binding globulin that is referred to by SHBH synthesis. It inhibits the deleterious activity of enzymes of the enzyme aromatase. So now they're starting to use more of the aromatase inhibitors as opposed to tamoxifen, where there's a receptor sensitivity issue. The ligands in the flaxseed influence estrogen metabolism by inducing, again, 2-hydroxylation of estrogen, as well as improve that good chemical 2,16-hydroxyestrogen in postmenopausal women. Now, how about osteoporosis? We know that the aromatase inhibitors, as well as tamoxifen, have a tendency to promote osteopenia and osteoporosis. So what about this now? IC3 or DIM supplementation is known to stimulate bone formation via the actions of, again, 16-OHE1, therefore reducing potential for osteopenia and osteogenesis. And of course, if you want information on this, that's all you have to do is call and ask for the pamphlet and the literature that we're discussing today. What about calcium in cancer, Dr. Jensen?
Thank you, Dr. Lala. Well, calcium and cancer. We're looking at apoptosis and the death of cells. Usually apoptosis is where cells are pre-programmed to die off. We see a lot of that in our study of embryology, say where blood vessels are being created. Normally it's like, it's not a tube that's being formed, it's actually a solid, almost like a stick or solid, and then the inside cells, once it's been formed, are programmed to die off, creating a tube such as the vasculature. So in addition to many other positive effects, calcium is involved in reducing cellular stress, or the aging of cells, and apoptosis, death of cells. When stress occurs in cells, intercellular calcium, when it's available, increases, which causes the activation of genes that encode proteins, which are designed to protect cells against oxidative stress. Therefore, it is of maximum importance that we do what we can to create and maintain intercellular calcium homeostasis, or for optimum health. So, in this case, though, we're finding that taking more calcium may not be the answer. As important as calcium intake is, and it's the largest ratioed electrolyte in the body. In fact, bone, we need it so much that bone is actually the storage device for calcium in the body, but we need it to make our nerves work, our muscles work, our heart work. So calcium is very important. And so to the degree that we digest and absorb calcium and utilize it by our body is very important. The only scientific method to determine that the internal levels of calcium in our serum and cells is through a blood analysis. That blood analysis has to be evaluated from both a clinical and a homeostatic basis. And so when we look at clinical and homeostatic basis, a clinical range are those ranges which were taken in hospitals, which help us to diagnose, but usually when people are outside that range of clinical, we find that they are presenting with symptoms of a particular disease. And so they become like a fingerprint of what that disease is. Then there's also a range that's taken from a healthier amount of individuals, and that has a much finer range, and that's for homeostasis, or the level in which it should be in healthy people. And by analyzing the two different ranges, it allows us to see trends or for the development of the disease, and helps us to help bring it back into relationship so that we can do this in a more of a preventative manner. So then, calcium in cancer, Dr. Lala.
And vitamin C in cancer also is important. That we know that vitamin C enhances the immune system. It stimulates leukocytes to release meloperoxidase, and it also assists in chlorinating uracil, which modifies or therefore weakens or attenuates mutagens, which would be involved in cancer development. How about cancer phase 2 liver enzymes and antioxidants, Dr. Jensen?
Thank you, Dr. Lala. Liver phase 2 enzymes, or isothioalkanates, is what we're talking about here. In addition to other chemicals, the liver produces enzymes referred to as phase 2 enzymes, which are designed to assist the body in detoxifying DNA-damaging compounds, which then are excreted by the body. The antioxidant vitamins C, A, D, E, and K, zinc, and selenium are different than the phase 2 enzymes in that antioxidants act by scavenging free radicals, whereas phase 2 liver enzymes have a longer lasting effect on the body because they are not metabolized as antioxidants are. So sulforaphane, which is contained in broccoli, is one of those things that's high in those chemicals that we need for phase 2 liver enzymes and antioxidants. How about cancer and vitamin D, Dr. Lala?
Well, we'll do that, cancer, vitamin D, but I forgot to mention something here about cancer and vitamin C. People who maintain adequate levels of vitamin C lower their incidence of cancer. In part, this is related to the fact that when cellular inflammation occurs in the bodies, white blood cells release an enzyme, and that's the one that I mentioned earlier to you, meloperoxidase, at the site of inflammation, which then chlorinates the chemical uracil, weakens it, which has the ability to modify the DNA mutagens. The chlorinated compounds do not directly modify your DNA, but rather act by damaging the nucleotides incorporated in your DNA. That's your desoxyribonucleic acid. That's who you are, okay? Research indicates that vitamin C and glutathione inhibit the potentially deleterious effects of those chlorinated compounds. Now, going back to what Dr. Jensen asked me to address, was that on vitamin D?
Yes.
Cancer and vitamin D?
Would you like me to follow that?
Why don't you do that, okay?
Okay. Cancer and vitamin D. Vitamin D prevents prostate cell proliferation. Very important. How about excessive calcium being bad? Well, let's look at this. In addition to many other health benefits, vitamin D is important in assisting the small intestine to absorb calcium and protect against osteopenia and osteoporosis. It is also known to be effective in reducing proliferation of prostate, breast, and colon cancer and multiple sclerosis. Excessive levels of calcium inhibit the function of vitamin D, which means that calcium, like all other electrolytes, and vitamin D must be taken in proper biochemical ratio. Vitamin D can be toxic to the body as well, but like calcium and other vitamins and minerals, blood analysis would give the opportunity to determine proper dietary intake. So again, measuring is so that we can manage more effectively. How about age and geographically related vitamin D deficiency, Dr. Lala?
The general information today should be about 400 international units per day before the age of 45, and between 800 and 1,000 international units per day after age 45. And that is a test. We run a vitamin D test on all of our new patients because it is so significant in many areas of health. Generally, up to the age of 45, the body needs a minimum of 400 IUs, or international units, of vitamin D per day. After the age of 45, an enzyme in the kidney called alpha hydroxylase, which transforms vitamin D into the most active form, which is 1,125 hydroxyvitamin D, or another name for it is calciferol, diminishes and becomes less active. Alpha hydroxylase decreases with age. The kidney is designed by the good Lord to transform vitamin D into this 125 hydroxyvitamin D. calciferol is 2 times more important than 25-hydroxyvitamin D. Now, this is very important to catch this. Pharmaceutical-grade vitamin D usually contains calciferol, which assists the body by raising blood levels of 25-hydroxyvitamin D. Calciferol is 2 times more potent. Did you hear that? 2 times more potent than 25-hydroxyvitamin D, and that is the most common form of vitamin D in all food supplements sold today that have vitamin D in it. After age 45, it is felt that vitamin D intake should be increased, as I said earlier, between 800 and 1,000 international units a day. I've only found one patient in the last 5 years that was taking too much vitamin D. The ones that I find are deficient in vitamin D are the people that have early signs or who have been diagnosed with cancer. There is especially significant to people who live in northern climates above 42 degrees latitude or are confined in residences where they have little or no exposure to sun, because sunlight plays a significant role in the body's production of vitamin E. And you need to have at least 8 hours a day of exposure to sun to get the vitamin D that you need. Yes?
Well, one of the things with looking at that is we're talking about that exposure should be to latitudes higher than 42 degrees. And from my interest in astronomy, I know that here at the Twin Cities, our latitude is 45 degrees, so we're above that. And what happens with that is that sunlight tends to reach at us at an angle so that it bounces off the Earth, and it's low in the sky, so we just don't get enough. The other thing is that we tend to be a fair complexion, and so we don't absorb it as well. And usually what you're looking for is for that conversion to take place in the thin layers of skin, those in the wrist, those in the face, those in the abdomen, for that to take place. And in this case, many people, though they're getting sun exposure, the best times for that to occur are in the spring and in the fall when the sun is closest to the Earth. But many times we have clothes on and all that during that point. Those who are skiers that have the skier's tan, that's fine, they're getting some of that, but generally not at the ratio that we want it. So,
nor is it full body exposure.
No, it isn't. So generally what we're looking for is when we supplement, we give the types of vitamin D that comes after the conversion that's needed by the sun and has to take place in the kidney, correct? Mm-hmm. So that we have to look at what kind of vitamin D we are taking.
So it has to be D-L-tocopherol.
Or calcitriol.
Right, or calcitriol.
Right, which is normally D3.
D3. And most of the stuff that's sold in the health food stores and in many doctors' offices is not that form of vitamin D. Why isn't it? Because it's cheaper.
Right.
They can make more money that way.
Right. So isoflavones, Dr. Lala?
I was thinking also about there is a difference in these products that are called pharmaceutical grade and food grade. When you buy a food grade product, and the only way you can get a pharmaceutical grade is from a medical doctor, chiropractor, and some nutritionists who are licensed to do that. A lot of people out there calling themselves nutritionists, or they're working in health food stores implying that they're a licensed nutritionist, but many of them aren't. But again, what you're doing is a pharmaceutical grade can only be sold by a licensed healthcare provider. The food grade can be sold by anybody. And so when you're dealing with a food grade, what the label says, it doesn't necessarily mean it's there, because very seldom are those products examined by the FDA. Very, very seldom. And now they're coming out as they're examining, as the FDA is getting more involved in this, and they're finding out that many of those products do not contain what the label says. Nor are the products in proper biochemical ratio. So why would I, as a doctor of chiropractic that is science-based in nutrition, why would I, with that orientation, want to tell somebody to take vitamin C or vitamin D or any of these other chemicals or calcium without first finding out what their internal levels of calcium are in their blood? It doesn't make sense, just as much as why would I want to give them vitamin D, which you can cause hypervitamin D-osis? Mm-hmm. Too much vitamin D is going to cause problems for that person. Why would I want to suggest to somebody that they take vitamin D when it could be harmful to them? Mm-hmm. So their blood is going to tell me. It's the same thing with vitamin C. you can take too much vitamin C and cause harm to your body. And there are different forms of vitamin C. They're derived from different types of plants. And so again, you could cause somebody to have worsening problems. You could actually predispose them to degenerative bone problems. You could predispose them to cancer by using too much of a certain vitamin or too much of a certain mineral. And many of these homeopathic remedies, my gosh, I mean, every hospital today, if you're going to have any surgery, they're going to, in the pre-consultation, the pre-surgical interview, which is usually done on the phone, is they're going to ask you, are you taking any vitamins or minerals or homeopathic remedies? Mm-hmm. Because they know that when they go in and have surgical intervention, that it could cause some serious hemorrhaging issues. And so these homeopathic remedies, as potentially good as they are, they can really set you up for a lot of problems, a lot of serious problems. So this business about nutrition, even though anybody can do it and anybody can play around with and anybody can do this or that, you can cause trouble.
Some of the things that like there's years ago, everybody was looking at shark cartilage. Mm-hmm. Shark cartilage for cancer, because sharks don't get cancer. Well, what you find is, like, some people, they'll go in and they'll have surgery, mm-hmm. and they're taking the shark cartilage to help with making sure that they don't come down with cancer afterwards, or that it comes back. And what they find is the reason why shark cartilage works so well, for sharks at least, is that cartilage fights against creating more blood vessels into that area. And what cancer does is it tends to give off those chemicals that make you build more blood vessels to that area so that it can leach more from the body and help itself. Cancer is very selfish in that regard. And so what we find, though, is if they're taking shark cartilage, since they can't lay down any new vasculature, they can't heal. So they're finding that their wounds, their stitches, it's just like they just sewed them up, and yet it's not healing there. So it's very important that people are informed as to what things to take and what not to take. And I bring up the shark cartilage because of the show being preventing cancer.
And so again, but they were selling shark cartilage. Everybody was pushing it. You couldn't walk in a health food store or a discount store and not have these big signs out there and saying, oh, it's good for this, it's good for that. And there was an implication, not necessarily saying we're going to cure it, but an implication that it might cure cancer, it might prevent cancer, when in fact it was actually working against the body. Mm-hmm. So Dr. Jensen mentioned one other thing that we should address, and that's isoflavones. Those are pretty common. They're phytochemicals found in beans, legumes, lentils, soy, and other plants. So they are SERMs, S-E-R-M-S, meaning that they are selective estrogen receptor modulators. Okay, they're selective estrogen modulators, which interfere then with 17B estradiol, a hormone involved in cancer, and increased in the production of what we talked about earlier, CYP12A1 in women. And so isoflavones are known to influence, to decrease the propensity of cancer, and or if you have cancer, it might be something that you want to talk to your nutritionally oriented healthcare provider about, because it may be very good for you. But again, seek your advice of your medical doctor. Don't be going out and throwing away the drugs they tell you to give you. Get some good scientific information from both perspective, medical as well as natural.
Through its and healing provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician, in care of Dr. Lala or Dr. Jensen, at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-8521. Thank you for joining us today.